relative to this. They
Good morning one more time. We'll just start our first meeting since what year, 2007 or 8 or something, for mental health. And Rob has a presentation which we can start with.
I'm Rob York, Director of Community Services, and as Peter mentioned, we haven't had a formal mental health committee meeting in quite some time. I'll explain a little bit about our structure. We're actually a shared administrative office between Warren and Washington counties, and you may have heard about the Community Services Board. We work with the Community Services Board. So I'll get to that as we go through. We have our offices downtown Glens Falls. We lease space from one of our contract agencies, the Warren Washington Association for Mental Health. And we're located on Maple Street. Being a shared office between the two counties, it actually works out pretty well being located there because we're close to, kind of in between the two municipal centers. Okay. First slide here is just an organizational chart that shows you the 5 employees of the office. There's myself. We have an office specialist, Cindy Wasson, Deputy Director Clinical, Megan Johnson, our Deputy Director Fiscal, Harry Carlson, and Program Analyst, Lisa Kutu. You receive funding from, and our services are regulated by 3 state agencies: the New York State Office of Mental Health, New York State Office of Alcoholism and Substance Abuse Services, and the New York State Office of People with Developmental Disabilities. The way that we're organized is spelled out in New York State Mental Hygiene Law, Article 41, and that specifies the role and function of the local government units, which is what we're referred to in mental hygiene law, and the community services boards, which I'll talk about in a minute. Mental hygiene law directs counties to either provide or arrange for preventive, rehabilitative, and treatment services for individuals with mental illness, developmental disabilities, and substance abuse issues. Some counties are direct providers of these services. Warren and Washington counties are not. Our counties arrange for these services through contracts with local not-for-profit agencies. So Article 41 requires counties to establish an identifiable unit within local government. That's where that term, local governmental unit, comes from, which is given authority in accordance with Article 41 to provide or arrange for those local services. The Office of Community Services is the local governmental unit given this authority by both Warren and Washington counties. So we are, as I mentioned, a shared local governmental unit. We're unique in the state of New York in being the only 2 counties that I'm aware of that have executed a formal intermunicipal agreement that details the sharing of the administrative office between the 2 counties. The employees of the office are Warren County employees, but the administrative costs, including salaries, the cost for our administrative unit, are total and split evenly between the 2 counties. And then there's a chargeback mechanism to Washington County once a year for half of the administrative costs. Article 41 requires each local governmental unit to have a community services board. Our counties have 9-member boards, separate boards for each county that meet jointly on a monthly basis, with the exception of August. In non-chartered counties, which both Warren and Washington counties are non-chartered counties, the Community Services Board is a policy-making board. In chartered counties, the Community Services Board is advisory to the Director of Community Services. Community Service Board members serve for 4-year terms, and officers are elected for 2-year terms. Screen shows a listing of our current Warren County Community Services Board membership, including a couple of vacancies. So you can see the composition of the Warren County Board. Mental Hygiene Law, Article 41 specifies certain prescribed composition that they look for. In the Community Services Board, it's supposed to be made up of individuals in the community that have an interest in the 3 disability areas. We also have, you'll see a vacancy there from a former Commissioner of Social Services. We've always maintained a slot on the boards for the commissioners, so later in the meeting I'm actually putting forward a resolution request to fill that slot. Okay, and then because we are, the boards do meet jointly, I thought I would just also include a slide here with the composition of the Washington County Board. Oops. With the boards meeting jointly, the way that works is that they do still act separately. They meet jointly. Often their business is sort of mirror business, so they open their meetings separately, they have their discussions jointly, but then they act separately as separate boards.
Just to maybe as an aside, Rob, just to some of the folks that are on the Warren County Community Services Board. I know Kimberly Brayton, who's a PhD, but I know she has a background. I think originally she came from Washington. She is a forensic psychologist. Did some work with the FBI. So I guess my point is we have I think a very talented and well-rounded group of people serving, on this board.
We try to keep a mix of professionals, important stakeholders like our DSS commissioners, because some portion of the services are funded by Medicaid, and we just think the DSS, obviously there's a lot of crossover in the population that we serve. We try to keep a mix of family members, recipients of services. So that's how we work it. Okay. So one of the responsibilities of our office includes the development and submission of a local services plan, and this is required annually by our 3 state funding agencies. This involves a multi-stakeholder process that is conducted through the subcommittee structure of the community services. Our current local services plan is posted on our county web pages on the county website. So the subcommittees, Article 41 requires that we maintain 3 subcommittees of the Community Services Board, one for mental health, one for alcoholism and substance abuse, and one for developmental disabilities. Subcommittees have planning, oversight, and coordination responsibilities. And all bulk of the planning that I talked about occurs there, but also it's a avenue where we invite our local contract providers to be part of the subcommittees, so that it's really a venue for coordination of services as well. This is pretty much what I just said. Provide a venue for service system planning, implementation and coordination of local services, provider collaboration, information sharing. There's always new information coming out from the state agencies, and having the providers together in the subcommittee, we're able to review everyone's understanding of the new regulations or new guidance that might be coming out. And just also multi-stakeholder problem solving. Around the subcommittee table, you might have families identifying an issue that maybe needs to be highlighted or addressed, and there's opportunity to review that and discuss that with the provider community. Okay, the subcommittees are comprised of CSB members, LGU staff, service providers, service recipients, family members, etc. They meet at least quarterly throughout the year. Committee, supervisors are certainly welcome and a part of that process, and frequently do attend. So that's okay. Our contract agencies. I thought I would put a slide together here to just show you a picture of the various agencies that we do work with in the community. These are all agencies that Warren County holds contracts with, and I put up the contract amounts there. You can see the Warren County side of things, approximately $2.5 million in contracts. Some of these agencies, the contract is just for a single service. Some of these agencies provide a whole array of services to the disability populations that we talked about. Next slide. All the agencies have presence on the web, so if you're interested in more information about any of these agencies, certainly go and explore and find more information about their services. Okay, I thought it would be interesting to show this as well, just in terms of demonstrating, that the contracts are primarily funded through state aid. You can see that the county tax levy slice is actually under $50,000 in terms of the contract services. Now, that's just the contracts. I mean, there's some county dollars in our administrative costs which aren't shown here. And then we have those lines in the budget that you may hear about from time to time for forensic psychiatric evaluations. And that's 100% county dollars when we talk about the forensic evaluations. So that just shows that split. And then of the approximately 50,000, not all of those agencies get county funding. So only certain agencies receive county funding, and that's through a formula through the state aid. But the three agencies that do receive a bit of county funding are the CWI, Liberty House, and the Warren Washington Association for Mental Health. The differentiation is not as clear on the black and white, but you can see that the largest portion there is actually Liberty House. And they provide pre-vocational and vocational readiness services for individuals with serious mental illness and developmental disabilities. Okay, just a few other responsibilities of our office, just to give you a snapshot of some of our additional day-to-day activities and responsibilities. Fiscal management and reporting related to the state aid contracts and managing the contracts. We operate a single point of access process. This is a referral process for certain high-end services, like care coordination and residential services that are limited resources. So what we do is we have a process to receive those referrals, review them frequently, work with our providers to try to match individuals that have the most need with the highest level of service, and then reviewing that over time so that when someone no longer needs that, we can move them down, step them down to another service to create an opening for, the referrals that are coming in. Megan Johnson, our Deputy Director, coordinates that. She also coordinates our Assisted Outpatient Treatment Program. This is also referred to as Kendra's Law. A number of years ago, New York State passed a law that allows for outpatient commitments, so that certain individuals that meet criteria related to non-compliance with treatment and dangerousness can be court-ordered to outpatient mental health treatment. And so we do have a number of individuals that are currently receiving court-ordered outpatient mental health treatment. And then the certificate of need or expansion of service approvals. We work somewhat in conjunction with the state when agencies are interested in developing new services. Obviously, they have to go through the process to demonstrate the need for that service and the need to receive approval from the service state agencies. General overall system coordination, other things that we are involved in from time to time, in the hygiene law, Article 9.45 gives authority to the Director of Community Services to remove people from the community when they're in imminent danger to themselves or others. And mental hygiene law prescribes who can be the reporter for that. It has to be certain individuals, a first-degree relative, a treating physician or clinician, and there's a few other categories. These are basically the situations where someone is threatening to harm themselves or someone else, and we can request that the police pick that person up and take them to the hospital for an evaluation. Also coordinate a county disaster mental health team. We have trained currently approximately 26 individuals who are master's level clinicians from various agencies in the community. We've trained them in a curriculum, pretty extensive curriculum on disaster mental health. So this team is coordinated with Amy Drexel and everything that goes on in terms of the county, both public health and also emergency services. So it's sort of a resource to them. If there's an incident, they want the team involved to be part of that, to provide some mental health support. And we do actively try to participate in the various drills that they do. There's some SAFE Act reporting that our office has to do when an individual is deemed to be likely to engage in dangerous behavior. Often physicians will report this through the SAFE Act portal. There's a portal, and clinicians and physicians are required, in fact, to report that through the SAFE Act portal. What happens to those reports is that they funnel through the directors of community services, who then either approve or disapprove and forward on to New York State. put a bullet here that also includes active involvement with various regional healthcare planning structures and initiatives to lower costs and improve efficiency and effectiveness of health and behavioral health care service systems to improve outcomes for the residents of our counties. We're involved in multiple planning efforts with public health, with our counterparts throughout the region to address both health and behavioral health care issues. My information is here. I didn't get this updated on the presentation on the handout. I'll include that information here. So happy to answer any questions. Feel free to call me anytime. Any issues come up, if they're come to you in terms of the town, constituent, they have issues, feel free to redirect them to me. I think I can be of any help.
Rob, I know recently, within the last year, Saratoga, Warren, and Washington County qualified for a grant for in-home psychiatric care. I think primarily focused on family, children. Was a grant that was a competitive grant, and so maybe just a short little summary of kind of what that's all about.
That is a contract that we hold with Parsons Child and Family Center. We did an RFP process. We selected them as the provider, and they do provide a crisis in-home service for children and families. It's short-term intervention, and it seems to be working very well. We're trying to look at ways that we can try to provide more crisis services to divert kids from the emergency room, not just kids, adults as well, but to divert from emergency room use and over-reliance on hospital use and high-cost services. So by trying to do more of this, in-home or preventive diversion, those folks and be more cost-effective in our services.
Maybe the last issue, and maybe we can get into more detail in this in future meetings, but where we are, where we've come from, where we're going in terms of heroin, and in both counties, certainly a national problem, not just a local problem, and I think we've come a long way. A lot of good people involved in the program.
We're part of a sort of a task force or group at the Council for Prevention, which is another one of our contractors we're heading up or trying to organize. And that group is also a bi-county effort, both Warren and Washington counties, and they're multi-stakeholders in that task force, including the DA's office. Kate Alford comes from the probation from Warren County is there. There's a number of departments that come, and just trying to strategize together about what are some things we can do with awareness to try to put forward a message of hope to the families that find themselves in these situations with a family member who maybe has gotten involved. So I think they're planning a community forum for either later in the year or maybe early next year at this point. But you'll be hearing more about that. And, if the committee is interested, what I could do is maybe have Dave Saffer come and flesh out a little bit about.
I think we've had two community forums, one in Hudson Falls at the high school, very well attended, and there was a showing of a film at Crandall Library called Anonymous People, which again I think was reasonably well attended and attempts to get a message across. Good. All righty, moving along, can I maybe get a motion to appoint Maureen Schmidt to the Warren County Community Service Board for the term 11/21/14 to 12/31/17. We have a motion by Rachel, seconded by Peter. All in favor? Aye. Second resolution to amend the 2014 budget for 820 River Street to add $6,880. Motion by Rachel, seconded by Pedro. All in favor? Aye. Okay. Very good. Are we under control? Any questions from the audience? Okay. Good. Can we get a motion to adjourn? Rachel, seconded by Peter. Thank you.
I did have, these handouts of the local directories of services, if you want any of those, more of those for the town offices.